Now we'll be discussing the FMGE questions which were asked recently, just yesterday. So pathology questions, first of all, we'll be dealing with the pathology questions. Now have a look into the questions and have a bit of concentration towards my explanations. Now, let's go straight. The first of the questions was asked, which of the following lesions describes Kaposi sarcoma? Now, there are multiple choices given, and you should remember that the Kaposi sarcoma lesions, they are HHV8, caused by the virus HHV8, and the lesions are usually purplish, and having some lesions may be characteristically elevated and reddish. So the color range of the Kaposi sarcoma lesions, which might be in the oral mucosa, which might be on the limbs, lower limbs, they are reddish or purplish. So there were multiple choices given, and you have to remember that they are characteristically purple red, elevated, and these lesions asked were the lesions in the mouth. So the first question was Kaposi sarcoma lesions in the mouth, characteristically red, purple, elevated. Remember this fact. Now, the second question which was asked was a chest radiograph of a 40-year-old male with occupational dust exposure. So there is a history of occupational dust exposure and bilateral hilar lymphadenopathy with eggshell calcification. The most likely diagnosis is, so this is very important. Now, there were choices which were given, and the choices given were tuberculosis, sarcoidosis, and asbestosis. But you have to remember that characteristic eggshell calcification in an occupational person working in an occupational industry for a long period of time with maybe bilateral hilar lymphadenopathy. Bilateral hilar lymphadenopathy is a characteristic feature of sarcoidosis in which we have non-caseating granulomas, but here there's a history of occupational drug exposure, dust exposure, and there is eggshell calcification. The characteristic eggshell calcification is a feature of this important disease, silicosis, which is by virtue of silica dust. I will be explaining some of the details further. So this is the second question about occupational lung diseases. Now, we do not end the occupational lung diseases here only. Another question was asked from occupational lung disease, and it was a question, a smoker who works in a cement factory. So that's very important. So what's the cash point is a cement factory for almost 20 years. So he has chronically developed some lesion, which is their, the history suggests that 10, 20 years, so that's very important. You have to just go through the question. And has mesothelioma. And the characteristic association is with what disease? Again, the choices given were tuberculosis, asbestosis, silicosis, and anthracnosis. So that's important. You have to remember that asbestos fiber, which are different types of fibers, they cause characteristic another type of occupational lung disease, and they are characterized by mesotheliomas, pleural plaques, and an association with lung cancers. Very important. So, two questions on occupational lung diseases. Remember that occupational lung diseases are very important. There is another disease which is berylliosis, and we can have another form of diseases in which there's an ingestion of cotton fiber dust, bagayosis. So these types of diseases are commonly asked from pulmonology. Now, so number 1, Kaposi sarcoma, number 2, silicosis, number 3, asbestosis. A newborn presents with upward slanting palpebral fissures. So here is a clinical case, flat facial profile, hypotonia, and a single palmar crease. But karyotyping shows 5p deletion syndrome. Now, you have to remember, so there is something which resembles other syndromes like Down syndrome, like Edwards syndrome, right, Pathology syndrome. But here, there is sometimes the last point of the question or the last line of the question is very important, and 5p deletion. And 5p deletion is a feature of Cry-Duchat syndrome. You have to remember, so the cash point over here is the last line, the 5p deletion. Otherwise, there can be an overlap in those syndromes, but he has given the pathologist the question. The examiner has been wise enough to give you a hint and a clue at the end. And remember to read the question in full. Now, Another question from pathology, say surgery. A young patient presents multiple dark brown to black macules on lips and buccal mucosa and has got hematomatous polyps. The most likely diagnosis is. Now you are well aware of this important, topic. Polyposis colon. Polyposis colon can be multiple. It's a very, very, very important topic. You have got the FAP, you have got HNPCC, you have got Gardner syndrome, you have got Turcot syndrome, you have got Crocite-Canada syndrome, and you have got Peutz-Jeghers syndrome. So Peutz-Jeghers syndrome is one important syndrome in which you have characteristic melanosis, cutaneous pigmentation of the oral and especially the buccal mucosa. And the polyps are hematomatous polyps. They have got a low potential to go towards malignancy. So the whole of the GIT may be carpeted by hundreds of polyps along with pigmentation of the mucosae. So this is a very favorite question, repeated multiple times, hundreds and hundreds of times in NEET, PG, FMGE as well as INICT. Here we're talking about FMGE examinations, and it has been asked recently and repeated. So remember this topic. Now, a 17-year-old boy presents with tall stature. So he's tall, he's having gynecomastia, well-developed breasts, but small testes, sparse facial hair and reduced muscle mass. He is noted to have infertility. So what is the karyotype associated with this condition? So you are well aware of Klinefelter syndrome. Klinefelter syndrome is commonly asked, and you have to remember the chromosomal configuration of Down syndrome, Turner syndrome, or Klinefelter syndrome. The most common karyotype associated with Klinefelter syndrome is 47XXY, and this was a question which was asked. So the options 47XXY, other options given were XO, XYY, but you have to remember this classic feature of Klinefelter syndrome. Now, genetics, gene mutations, very important, and this was asked. FBN1 gene mutation is seen with which genetic disorders? There were multiple syndromes given, and you have to remember that fibrillin gene mutations are a characteristic feature of Marfan syndrome. Marfan syndrome is one important disorder in which you have multiple pleiotrophy of things like the high arched palate, tall stature, big arm span. I mentioned the high arch, dislocation of the lens of the eye, in addition to mitral valve prolapse and myxomatous degeneration of the mitral valve. These are some of the features, but here the question simply focused on the genetic mutation. So F1BN1 mutation is characteristic of Marfan syndrome. That's important. Now, we have got the general pathology and many questions asked from general pathology, cell injury, inflammation, and here the question asked was about apoptosis. You know the programmed cell death. It is a very, very important topic, and it was asked, what is the pro-apoptotic factor? You have to remember the anti-apoptotic factors and the pro-apoptotic factors. And the BAX you cannot forget. You cannot forget the BAX as a pro-apoptotic factor which promotes apoptosis or programmed cell death, which is an important phenomena in many pathological as well as physiological, embryological processes. So that's important. Now, again, syndromes, Downs, Edwards, Pathology, I told you, Klinefelter, Noonan's, and here, the most common cause of a single transverse palmar crease is. So we have got the palmar creases, but some patients congenitally have got only a single transverse palmar crease, and that is a classic feature of Down syndrome, though it is present in many other syndromic entities, but Downs has got a high frequency. The overall ratio and the overall incidence of the patients with Down syndrome is far more outnumbers the other syndromic entities. So you have to remember Down syndrome. Now, another pathology question, maybe a question from hematology, mixed question from forensic, but it was placed in pathology. Basophilic stippling of RBCs is characteristically seen in case of, and you know there are these various important things like the copper poisoning, the arsenic poisoning, the mercury poisoning, the lead poisoning. Lead poisoning is associated with many features like abdominal pain, colic, constipation, and basophilic stiffening of RBCs. It is a characteristic feature of lead poisoning. So you have to remember these features, which I have mentioned in my book, which I will be coming at the end of this class. Now, HPV causes which of the following head and neck cancers? So you have to remember HPV. HPV is a human papilloma virus, and it is implicated in many carcinogenesis of especially the CA cervix. But over here, which of the head and neck cancers is more common? It was mentioned thyroid, it was mentioned palate, it was mentioned oropharynx. And oropharyngeal cancer happens to be oropharyngeal cancer happens to be the most common entity associated with human papilloma virus infections, because HPV is an oncogenic virus, and there are many viruses and many pathogens which are oncogenic, like the H. pylori, which causes gastric lymphomas, which causes maltomas, which causes gastric cancers. In a similar manner, we have got this HPV, Helicobacter pylori causes all these things, and HPV causes carcinoma cervix and oropharyngeal cancers. That's important. Now, a child has a history of eating sand and soil, which is not a common feature nowadays. And this is particularly in suburban and malnourished children. They eat soil and sand, and the blood film is given, which shows microcytic hypochromic anemia. And basically, this is called a spica. Intake of soil or sand, and this is a feature of particularly of anemias, especially the iron deficiency anemias, which is common in case of children. Now, this is again the genetics, mutations and genes. I again re-emphasize the fact that they are very commonly asked. SOD1 gene is implicated in which clinical condition? You know, amyotrophic lateral sclerosis, in which there is degeneration of many tracts of the spinal cord, in which there is, a part of degeneration of the nervous system, and patients present with a huge range of symptoms. And it's a deadly disease, it's a progressive neuromuscular degenerative disease, and amyotrophic lateral sclerosis is this condition, ALS, von Gerg's disease, and it is associated with characteristic mutations of the SOD1 gene. So you have to remember, these are sort of one-liner questions. You have to remember the genes and the causations. Now, another question. 12-year-old had fever with lymphadenopathy and had a diagnosis was anaplastic large cell lymphoma, and it is associated with which translocation? So the characteristic translocation, you have to remember T25. So that is very important. These translocations, they are important in case of Burkitt's lymphoma, in fibrosarcomas, in many hematological conditions. So you have to remember the translocations, and you have to remember the genes. So what you can just summarize is that the questions from pathology were from general pathology, from systemic pathology, from genetic aspect, and from clinical scenario, and especially syndromic entities are asked quite frequently. Now, I will just come to the final points of this thing. Now, this, we have got, these are the snapshots from my book, NEET PG QR Quick Review and Platinum Q Bank, wherein I have this, I have just summarized what has come from either the Platinum Q Bank, Volume 1, Volume 2, Volume 3, and NEET PG QR. So Cry-Do-Chat syndrome was asked as a question in FMGE. Frankly, I was never involved in this paper setting or anything, but it is what you read, the standard textbooks, the standard matter, the standard quality always matters. You can only achieve high percentile, pass with a good range, good percentile, only once you reach standard. There's no shortcut. So Cry-Do-Chat syndrome. So you can see that Cry-Do-Chat syndrome is given in NEET PGMR, and I have shown all the features which are seen in this disease. Now that's one aspect. Number second, Klinefelter syndrome. In the FMGE question pathology, it was given a feature, atrophic testes. So this is something short from my NEET PGQ. So I have emphasized that atrophic testes are a feature of Klinefelter syndrome, along with gynecomastia and other features which were mentioned in the question as such. Now, Have a look at this thing. Peer-Jogger syndrome. This is a paragraph from NEET PGQR. So the syndrome is characterized by hematomatous polyps, which I have mentioned in my book, and it is associated with mucocutaneous pigmentation. I was mentioning you melanosis of oromucosa, as well as there might be rarely pigmentation of the peripheral parts of the body as well. So you can see that skin pigmentation, as I mentioned earlier, has been mentioned in NEET PGQR book. So this is how you read and come to arrive at the answers. Number third. So this is the question which I have put, and even the question number is here from the Platinum Q Bank. So this is a question has got mucocutaneous pigmentation, as was mentioned, had polyps, and I have given all the information about Peer-Jogger syndrome over here. So melanotic, melanosis, cutaneous pigmentation. As you can see, then I have explained the Peer-Jogger syndrome in detail to give you an idea that how the questions are framed, how the questions are asked. So this is now, the question was asked, Klinefelter syndrome. I was telling you the chromosomal configuration you have to remember. Normal females, XX, normal males, XY, Turner's, XO. And here is the question, XXY, in case of Klinefelter syndrome. So that's it. You have to table it. You have to have a simple idea what is asked and what can be asked and what can be expected. Now, this is a question number 74 from Platinum Q Bank. And I have mentioned Simon Palmer crease, single Palmer crease in a boy. And this is a case of, I have given a case of Down syndrome. Multiple other defects. I will not mention those things here because it's a huge topic then. So single Palmer crease, Simon crease, other things like endocardial cushion defects, VSDs, ASDs. I will not go into detail, just to show you that why this Platinum Q Bank and NEET PGQR are indispensable for FMGE, NEET PG and INICT exams. Now, punctate basophilia, basophilic stippling, and I have given it a question number 62 in my NEET PGQR and FMGE Q Bank. So I have mentioned anemia and lead poisoning. And more important than that, basophilia. I would analyze that punctate basophilia. So that's important. So HPV, I was mentioning carcinoma cervix, but it was not given as a carcinoma cervix. And then question number 62, ENT, and HPV 6 and 11, also associated with respiratory juvenile papillomatosis. So you have to remember these things, oropharyngeal cancer as well as respiratory papillomatosis. By the way, now eggshell calcification. This is question number 25 in hilar nodes, silicosis. No confusion. Then asbestosis. This is the part 3, volume 3, image-based platinum, wherein I have shown asbestosis by virtue of mesotheliomas, lung cancers, pleural effusion, as well as pleural plaques. This is something which is important. Nothing downloaded from Google, nothing copied from anywhere. It is all copyright. These are the images which I have drawn myself, and so that the students understand these things in the most precise of the manners. So this is asbestosis. Remember this figure, and your worries about occupational lung disease, at least one asbestosis is gone. So then, in the explanation, simple, short, crisp, lucid. Mesotheliomas, pleural plaques, effusions. History of work in the industry, as I was mentioning. Now, again, repeat, punctate basophilia. And this is lead poisoning. And then I have just underlined this thing. This is a high feature that all the things which are very, very important have to be underlined, emphasized upon, and stressed upon. Why? this thing. So there's a separate paragraph. Now, even the question, now in the FMG question, it was not mentioned. Shipyard workers are especially associated with asbestosis. And now, rest of the things about asbestosis, I have mentioned you. Bronchogenic CA association, pleural plaques, and other things. Marfan syndrome, question number 69. I think questions in a row which have been asked. I mentioned tall stature, scoliosis is an additional feature which you can remember, and fibrillin gene. Now see, the last, this is the F1BN1, the question which was asked in your exams, FMG exams. This is the way you have to, the best examiner is he who, or the best teacher is he who predicts what can be asked, and you have to predict the future. You have to be one step ahead of the examiner, and that is the way the best teachers in the world are. They know what to expect, they know what can be thrown at you, and then you have to respond from the front foot and go a step ahead than the examiners. Down syndrome, and again I told you Down syndrome is asked, and over here single palmar crease. I repeat it. This is, I have given it in a different manner, but the thing is that once you have read the question and a good explanation, you will never forget. Never. Question number 74. Now, punctate basophilia. I repeat it, it was shown, and I repeat it again. So this is how we come to arrive at some of the questions which have been asked over here. So this is some of the things which have been, these are the questions which have been asked. And what was our focus? Focus was FMGE, pathology. I will be coming across some more subjects in a more detailed and lucid manner and show you why platinum cure bank and NEET PGQR. So I wish you best of luck in your exams. The results might be coming up ahead, but over here there's nothing to fear, there's nothing to worry. And for the students who are preparing for the FMGE examinations ahead, I would recommend them, I would strongly recommend them, NEET PGQR and Platinum Cure Bank, Volume 1, Volume 2, Volume 3. So this was with I mean a lot of evidence. I have given you what types of questions were asked, from where the questions were asked. So there's something which is there for you, very important, very critical, because I got a lot of calls from students overall, and this is the way I would respond. Thanks a lot. Have a good day.